which requires local government and organizations to take action on accessibility in communities across BC. So here's the question. If elected, what will you do to work with all people with disabilities in our community and with local governments or organizations to achieve accessibility and universal access from all members of our community?
Great. Okay. All right. Can you hear me at this level? Is this okay? In the back's okay? So I think what I would do if elected and to work with people with disabilities to increase accessibility is do what I'm actually doing already. I have already been working with people with disabilities in the community to increase the accessibility. I have a very good friend, Julia, who is visually impaired, who works on my campaign, who's worked on my farm. She informed me how difficult it is for her to access certain buildings with stairs because the difference in elevation was not something that her eyesight could pick up on. So we together put in a presentation forward to the City of Courtenay, to the CVRD, to Town of Comox, and to Cumberland, informing them that they had stopped putting paint on the edges, the back edge of each of the steps leading up to the art gallery, to the library, all kinds of places in Comox. And it was an easy fix, but it was something that staff in the city hadn't realized needed to be maintained or had never been done before. It really requires working with people.
The question is about drought and agriculture. Climate stress is intensifying summer drought conditions and water stress. Farmers in the Comox Valley have been among the first to have their livelihoods impacted by water stress and water license restrictions. What should the province do to enact preventable, equitable water policy that ensures ecosystem protection as well as food production?
Great. Thanks, everybody. Can you hear me if I'm speaking at this? Okay, I gotta project. Okay, so my name is Arzeena Hamir. I am actually a local farmer, so I feel I'm at a bit of an advantage to everybody else because I actually lived this in my own farm. 2023, oh, this is going to be hard. I know. No, I think the mic is only going to the camera, is it? Yeah. So 2020, maybe if you guys can scooch in. No, yeah. Okay, everyone's got the right idea, same idea. Okay, so 2023, last year, was probably one of the most difficult farming years I've ever experienced in my 20 plus years of farming. I'd never seen a season where rain stopped in May and it didn't start again until late October. We had previously dug a dugout on our farm to capture winter rains and allow us to irrigate without having to top into the aquifer or use, nearby creeks. We thought we had done all of the right things. Last year was the first year we ran out of water. And I don't know about you, that feeling of not having water security was so visceral, so difficult. I mean, we honestly had to plow under crops because we didn't have enough water to see them to proper maturity. Without water, there's no food, and without food, there's no farms. And then where do we get our food from? So some of the things that the government has done, unfortunately, to exacerbate the issue is that this whole idea of dugouts, digging a hole in the ground, capturing winter rains, is now something that the government wants to license and force farmers to pay. It's a very difficult thing to get your mind around, but the only thing... Yeah. Yes. So dugouts now require a license by the government. So capturing rainwater on your farm currently requires you to submit a license and pay for that water. Unless you line the dugout with plastic and ensure that there's no interaction between your dug hole and the aquifer. So just to give you an idea, the cost to put in our dugout was $10,000. I asked the installer, what would it have cost you if we had to ask you to line this? And he said, well, probably about 80. It's an 8 times difference just by this one piece of legislation that has come in quite recently. The government is literally increasing costs for farmers by 8 times. So then I approached our Ministry of Agriculture and said, do you realize what you've done now in terms of cost? All of this extra burden on farmers. And do you know what their response is? Oh, well, we've got some grants for that. So that's your and my tax dollars putting into a grant that farmers can now apply for just to pay for the 8 times now cost that the government caused in the first place. Do you see the ridiculousness of this? Does anybody else see how ridiculous this is? Not only should farmers not be paying for dugouts, they should be paid to put water on their farms. This is a distributed, equitable way of ensuring that this community has water security. Not only do the dugouts allow for irrigation, they are our community's emergency response if we ever had a fire in the rural areas. Our dugout is 1 million gallons of water. This is something that rural fire departments could then use if the need, God forbid, ever happened. On top of that, if anyone's ever put water on their property, if you've put a pond in your garden, any type of water feature, suddenly insects show up. Bees, dragonflies, birds that then eat the insects, and then the food chain. The biodiversity that happens when you add water on your farm. Again, this is something that is an ecological service that when farmers put water on their land, we are benefiting the entire community. So what I am asking, and when I get elected as your MLA, is to totally deregulate the water, the dugout system, and then force all of the people to the table that are currently part of the water issue. And primarily who I'm talking about is forestry. Because we know farmers and fish and the ecosystems downstream are feeling the impact of really poor forest management upstream. And nobody is taking forestry to account. So having them at the table and forcing them to provide impact to farming, impact to hydrology before they do any kind of cut, that I think is going to be revolutionary for our watershed management. So, yes, I think I cut that well. Yeah, thank you. I know that one quite deeply, so didn't have to look at my notes for that. But I just want to say the drought from last year continued this year. There's just a lot of stress in the farming community about water use. There are water police that are visiting farms to see if they have licenses for the water that they're using. The fines have now gone from $230 to $10,000. Yeah, talk about a war on farmers.
We're going to get on to the next question in just a couple seconds here. What I'm going to suggest is, again, we've run into acoustics here. I'm going to encourage people at the tables to wrap themselves around the table that the candidate's sitting at, if they would like to do that, to be a bit closer. And it may also help if the candidates stand up to answer questions.
Okay, can do that. Yeah, chair here.
Move on to the second question here. As soon as I do whatever I did with my timer there. Hold on. Okay. Okay. So the next question is coming from the Comox Valley Social Planning Society. The current earnings exemption limit for those receiving benefits from the Ministry of Social Development and Poverty Reduction does not meet the needs of people receiving benefits, and it is unnecessarily bureaucratic in practice. If elected, what would you do to 50 nonprofit leaders, advocates, and community partners in the anti-poverty and disability rights sectors to abolish the earnings exemption limit for people receiving income assistance, including those with persistent and multiple barriers and those who are receiving people with disabilities benefits.
Right. Okay, I'm going to stand up. Did everybody hear that question? Okay, this is about disability benefits and the clawing back that currently happens. Does anyone have any idea what disability benefits are right now? It's around $1,400 a month. The poverty rate is $2,200 a month. We have literally legislated people on disability to be poor. We are not funding people even close to what disability and what poverty rates are. And then on top of that, if they are able to work at all, or if they want to be in a relationship with somebody else, suddenly we start to claw those payments back. It is incredibly cruel. I just don't have any other way to describe this. This needs to stop. And today, the BC Greens unveiled their entire platform. It's 72 pages long, and so I've just flipped over to the poverty alleviation. And this issue is paramount to how we work on alleviating poverty in our community. It's by increasing the rates. The single person rate will go up to $2,400, and there will be zero clawbacks. Zero. I mean, it costs nothing for us to not claw back a disabled person's, funds. There will be zero cost to do something like that, but the impact would be so incredible. Finally, people on disability can be in a relationship without being penalized. I mean, can you think of, is there a movie script that you can think of where this would actually, people would say, oh no, you're making this up. Well, this is actually the province of BC, how we have treated people on disability. We've literally taken money back from them when they want to work. I mean, why? Why would you disincentivize people working? If people can and they choose to work, this is something that we should incentivize. I've just come back this morning from a talk to the Rotary Club of Courtenay, and many of them are local business owners, and they are in such desperate need for staff. I mean, hiring people with disabilities, I think, would be so fantastic here in the community. Many of those that I work with a lot of people with disabilities. They are the most loyal staff people I've ever seen. And, we just need to really educate a lot of our employers to make sure that they understand how to accommodate. And then, yes, remove these types of ridiculous barriers that keep people in poverty. So the single person benefit would increase from, right now it's $1,060 to $2,400. This is not a small issue. There are over 170,000 people in British Columbia who are currently on some sort of disability assistance. So this would be incredibly impactful just by making these changes to stop clawing back and increase the base rate so that it's at least above poverty rates. It's a pretty simple answer, and I don't think I need to belabor it by talking on and on. So maybe if there are questions specific to this, please feel free. Yes.
You mentioned that there'll be no clawbacks.
Yeah.
Will there be any reductions, for example, of the marital status?
No. So thank you. The question was, I've said there'll be no clawbacks for workers, but if marital status changes, no. The BC Greens have already fundamentally said that is not going to, they're removing any type of clawback, whether it's a person's status in terms of relationship or if they're working or not. Yeah. I think it's 16 hours. Yeah.
That they would have a certain amount of that reduced.
Yeah.
I just did the math really quickly. If somebody was working at 35 hours a week at $20 an hour,
on. Right. Okay.
Candidates, you have 1 minute. 1 minute.
Yeah. Okay. Can you explain why someone who's working poor would be getting less than someone on Yeah. Yeah. Okay. Right. Yeah. Yeah. I don't see a problem with elevating people's position in life. I mean, this, in my opinion, is the beginnings of a universal basic income, which I think everybody, regardless if not just for people on disabilities, anyone should be able to have this type of support. Now, if you have this base and then you work on top of that, I personally don't see, making another 2,400 rents here, 22,000, like 50% of your wage is still going to be going to rent. I don't think it's going to make anybody rich in this community. Yeah, yeah. Right.
Okay, so the next question.
Okay, maybe we can discuss after. Thanks.
Candidates can just wrap up. Great. Okay, so the next question is from the Early Years Collaborative. Okay. Given the success, can I just ask for candidates to wrap up so we can ask the next question? Thank you. Okay. Given the success of the current Child Care BC plan, which includes the $10 a day child care and the immense positive impact it's had for families with young children, what do you intend to do to make sure that the current plan continues with dramatic increase in the number of high-quality $10 a day spaces, and any future plans includes a fair wage grid for early childhood educators, including access to quality post-secondary training? Yes, and just again, this question comes from the Comox Valley Early Years Collaborative.
Great, thanks. So my understanding is in the Comox Valley, we only have 3 $10 a day daycares available. There's one at Vanier School. I think there's one at Tigger 2. There's one more. The space is not enough. I spoke to one of the managers at the Vanier $10 a day daycare. The wait list for families is 1,000 families long. That is incredible. I mean, it absolutely shows how desperately needed $10 a day daycare is. It is, like right now, I don't know many families who can afford to have both, even one parent stay at home right now. We do need to have both parents working in order to pay for rents. So what the BC Greens have put on their platform is a multifold. I mean, they look at $10 a day care as incredibly important. It needs to be expanded. We need more spaces, but the more important thing is we need more workers. We are putting our most precious resource in the hands of people and paying them barely a living wage right now. $20 an hour in the Comox Valley is no longer a living wage. That needs to increase eventually. The Greens have identified between $30 to $40 an hour. I think when people see that level of payment for someone who works in EC as an early childhood educator, that will incentivize more people to consider that as a career path. Like that amount of a wage is something that someone could earn and actually make a very good living at. However, we know we need funding for people who want to study in ECEs because, there is a lot of education that is required, certification, and so the BC Greens are also looking at providing either subsidies or bursaries to encourage more people to get into ECE and then eventually to work in our childcare centers. I love the idea that I think the BC NDP started with putting more childcare in schools. Those are some perfect spaces for childcare to happen. It needs to be expanded. It needs to be expanded quickly because we've heard 1,000 families wait list. It's almost like a lottery if you get one of these positions in a $10 a day daycare, and we just need to make it way more accessible than it is right now. Questions about that or experience that people have had? Which
incentivize family or friends or grandparents
yeah.
through tax incentives to become undocumented child care.
I'm not sure if that's the role of government to pay for family members to care for. Yeah.
Reduce the tax, which is
Okay. All right.
so basically there is a cost.
Yes. Yeah.
Family members
Sure.
taking care
Of.
and $10 a week.
Yeah. Yeah. Okay. And so, yeah. I hadn't thought of that. Thank you for bringing it up. It's something I can take back to the party. And that's one thing, and maybe folks don't know that as a Green MLA, I'm not whipped to this platform. If I disagree with this, or if community says, actually, we don't need more spaces, we need more at-home care, that's something that I can advocate for without being, scared of any kind of retribution from the party. But I hadn't heard that recommendation, so thanks for letting me know. Yeah, Megan.
Can you talk a little bit about the for-profit daycares and how that intersects with the $10 a day?
I don't know a lot about for-profit. I just know, when my kids were growing up, we shared a nanny with a neighbor. The nanny was she was a nurse, which was great, but she was not an ECE instructed person. So I have a feeling there's probably a lot of staff at privately run daycares that don't have the same level of education as a $10 day or a government sponsored. I think there's still the ability to take in children at home. If you've got children of a certain age, I believe you're still allowed up to 6, and that's in your home as long as your home is safe and you're inspected. But then the education requirements for the staff or the people who are running privately are not the same as they are in the government system. Yeah.
What I can tell you is my daughter-in-law is an
Yeah.
educator, and her wage is poverty.
Yeah.
And she's gone to school for 4 years.
Right. It is. So, if you can take home the idea to her of being paid between $30 and $40, if that would make a huge difference, I would hope. But yeah. Any other questions?
Candidates, you have 1 minute. 1 minute.
Yeah. I did raise my 2 children here. Oh, Stephen, go ahead.
The idea of raising the minimum wage is an attractive idea for people. Of course, business people, they often will claim to do that or passing on expenses to make things people.
Yeah. Yeah. It's a really difficult situation because I feel that myself, right? As someone who hires people and then creates a product to sell at market, the biggest cost in local food is labor, right? 70% usually. So increasing wages it does equate to a higher price of product. What I've discussed with many of the business members is a lot of people need that higher wage because the rents are so high. If we have rents that are in the $600 to $800 per month,
We're going to do
not as
6
needed.
questions at
Yeah.
each table, and then the candidates will move. Okay, so we've got a few more here to do.
Yeah.
This next question comes from the Immigrant Welcome Center, and the question is: between 2016 and 2021, 775 new immigrants came to the Comox Valley. How do you feel our community is doing in welcoming newcomers, and what recommendations does your party have around immigration going forward?
Okay, great. So the question is about immigration, and we've had 700 people come to the valley, new immigrants from abroad in the last 5 or so years. I really welcome that. I mean, as you can probably see, I am an immigrant to Canada. My family is originally from Tanzania. I grew up here, though, from the age of 3. But I think my family and immigrant families really bring a lot of richness to Canada. They bring a lot of hardworking behavior, and hey, I love the expansion of restaurants. I can't lie. That's been a really great bonus in the Comox Valley. How are we doing in terms of receiving immigrants? I think overall, people in the valley are incredibly kind and very welcoming and curious. I am, however, hearing from the immigrant community themselves, times where they're feeling scared, where racist comments are said. So racism is a quiet thing that happens in the valley, and sometimes not so quiet when it ends up being on rants and raves. But it is certainly an issue that we are not dealing with well here. We don't know how to talk about racism. And what do you do when you hear a racist comment? Do you try and intervene? And, I hope the answer to most of you is you would feel comfortable intervening. Because honestly, when no one intervenes, the person who is feeling that vitriol against them, incredibly unsafe, they feel this is not the community for them. So I really hope we as community learn to have the discussions of how you intervene, how you are an ally. It's always wonderful to be curious. And I think some people are scared of asking questions about people, where they're from. I don't think most people mind that. Where the issue happens is when people don't step up when they need to. And I think that is not the way of the community. When I first arrived here, one of the reasons we chose to be in the Comox Valley, we came into Home Depot, and like 3 or 4 people came up to us and asked us, hey, what do you need? What are you looking for? I see it all the time. People come forward. They lean into helping. We are a fantastic community of helpers. I think our response to newcomers needs to reflect that ethos that we've always had in the Comox Valley of coming forward and helping people to find the housing that they need, helping people with their English, because that is probably between their English and housing, those two supports, equally needed. I see Shumps here from the Immigrant Welcome Center. I know IWC is doing a lot of incredible work, and brand new classrooms are here. We just need more, because I don't see, I've heard people say we need to pull up the drawbridges around Vancouver Island. We have to pull up the drawbridges around the Comox Valley. I don't see that as healthy at all. My mother-in-law has dementia, and she recently broke her hip. And we're very thankful she got placement in the Views. I looked to see all her caregivers. There's one woman from the Philippines. There's one woman from India. There's a gentleman from Zimbabwe. All of the caregivers right now who are supporting my mother-in-law are originally not from here. They're quite newcomers. I think that we have many newcomers who are filling that need of care workers that we just do not have enough young people in our community to fill. So let's see newcomers as the amazing resource that they are. I want to welcome them. I want them to feel safe, as everybody should be feeling safe in this community. Yeah, thanks. Yeah. 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 Unless you were a nation, right? Yes. It just like timing. Who got here first, right? Yeah. Yeah.
Candidates, you have 1 more minute. 1 more minute.
Yes. Yeah. Yeah, 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 yeah. And I don't know if there really is a role for government in here, other than like, you don't want government telling you to be kind, right? I mean, that should just be something that we do. But if there's anything that we can support in terms of training people of how you intercede when you see something, if there are protocols that need to be in place when something escalates to an RCMP requiring being called, right? I don't know if you recall, there was a group of young men playing cricket in Lewis Park, and all kinds of racist things were told to them for playing cricket. I mean, that was just odd, and it should be
All right.
a head scratcher. I don't want to see that happen again. Yeah.
Candidates, we'll move on to the next question. Thank you. Okay, so this next question comes to us from the Pride Society of the Comox Valley. So across Canada and the U.S., various governments are creating legislation to minimize the rights and safety of queer and trans people, or they're taking steps to outright ignore current legislation meant to support the legal rights and safety of queer and trans people. In Canada, we've seen such actions in New Brunswick, Saskatchewan, and Alberta. So first, the question is, what specific steps will you take to ensure that the elected government party does not try to eliminate the legal rights of queer and trans people, including youth in British Columbia? And if you are a member of the governing party and the party tries to minimize the rights of queer and trans people, how will you stand up? Finally, if you choose to follow the lead of a governing party in minimizing or eliminating the rights and safety of queer and trans people, how should your constituents hold you accountable?
Big question. So, first and foremost, the policy of the Green Party is that love is love, and everybody needs to be at the table in whatever identity and whatever position they feel, to be their whole person, because we are in a time of multiple crises. Climate, opioids, health, mental health. To solve those problems, we need people to be their entire selves, to come to the table with their creativity and their ideas. We are not going to solve our problems using our old mindsets that we use to create those problems. So we need everybody, and especially we need our young people to feel their most comfortable selves. And whether that is, in terms of sexual identity, in terms of orientation, it should not even be, it's not something that I even could consider be a barrier. So sometimes it's hard for me to put into words like how I would even see this being a problem. Everybody needs to be at the table. We need everyone. And everyone needs to feel safe so that they can contribute. I know it sounds a little bit transactional, but I'm trying to explain, A, why it's incredibly important, but also B, just in life, people need to be who they need to be. And we should all support everybody to be their most true selves. Does anyone watch Netflix? Can I please recommend a recent film called Will and Harper? Okay, it just came out. It's Will Ferrell, the comedian. His longtime friend came out as being a trans woman very, very late in life. He wishes he could have done it earlier. And if he had done it earlier, how fewer suicidal thoughts he would have had. It was literally the day he transitioned that suicide stopped being an issue. I cannot imagine how much brain energy it requires people to not be suicidal because they're not feeling that they're safe in the way that they're being in the world. We just want everybody to not have to worry about that. That should not be something that people consider, especially in schools. Trans children are the highest percentage of those who have suicidal ideation. And if young people feel comfortable enough to show their true selves, I think there would be so much better happiness and joy. And then they can study better. I mean, again, if you're trying to be transactional, we need young people to just learn better and be better individuals, because our society desperately needs them. So if nothing else, if you don't see the benefit to yourselves of having individuals be their true selves, these are the people we need in our community. So please, watch that film. It was a wonderful cross-U.S. trip of Will and Harper, and I thought it really showed some of the issues. I mean, they stopped in Texas, and that was interesting. And so it's also a really great way of showing how to be an ally, and sometimes how we have blind spots when we think we're doing good things. So this is the lovely thing that our arts allow us to show, right? Films, any other types of art really help us express the things that we need to say and need to do, and sometimes it's a lower barrier system. So when it comes to policy, the Green Party fully supports SOGI 123 as a way of educating our young people on how to be inclusive and how to prevent bullying in schools. That is the only reason SOGI is there, so that young people feel safe. It is not an ideology. It is not a conversion system. It is literally an education system to show people who they are and to treat each other with respect. I think that's all of us want, is to be treated with respect for who we are and to not have to hide ourselves. So let's all be trying to be the people that others feel safe around, to be their true selves. So SOGI 123, and obviously in any kind of workspaces, people should be protected in whatever way that they want to be in space. Workspaces should enable that. Okay. It was Will and Harper. Yeah. It's a really great it's a documentary following them across U.S. road trip. Yeah. Have I read, which SOGI books? I've never seen a SOGI textbook. Are there any teachers here? Any teachers? I've not seen a textbook that says SOGI. Okay. Yeah. And my mom was a teacher, so yeah. I've never heard of a thing. Has anyone heard of SOGI textbook?
Wrap up your answers, please.
Has anyone seen a SOGI textbook? Do you know a SOGI?
Is coming from the Comox Valley Coalition to End Homelessness. And the question is, even affordable housing options remain out of reach for many who are most vulnerable. What specific policies or programs would you support to support, what specific policies or programs would you support to support those who can't afford existing affordable housing options?
Yeah. I would say there's probably very little to limited supply of truly affordable housing. So I have a definition, and the Green Party has a definition of what affordable housing is. And that is rent that is not more than 30% of your income. So maybe consider, if any of you are renters, how much you are paying for your rent versus your income. I would say on average, people are spending 50, 60, even 70% of their income on their rent, and that is not affordable. So we don't have enough supply, and we don't have supports for people who are trying to access any kind of supply. Unfortunately, we have left it to the marketplace to try and build our way into affordability, and it is not working. Has anyone seen all of the development that happened around Superstore? 1-bedroom apartments, 500 square feet, $1,700. 2-bedroom, $2,400. that was supposed to be affordable housing. Like, that's why they were such micro suites, 500 square feet. And it has not worked for us. We have an unlimited demand of people wanting to move into this community. I mean, we live in one of the most beautiful communities, right? You cannot use supply and demand in a situation where the demand is unlimited. So what do we need? We need government to invest in the housing and ensure that the rents are tied to income. We have some great examples of that already in the Valley. Derry's Place, which is just across from the hospital, those units are tied to income. And the newly opening Wache Seniors housing is also rent tied to income. So the model works really well here. It's just the government put all of their eggs in these last few years in the densify basket, and that is not working. The Green Party's platform around affordable housing is investing $1.5 billion into creating 26,000 units across BC. So we know that it does require government funds so that we can also make those requirements around the 30%. So until that happens in the Valley, though, what can we do? Here's some of the things that I've noticed as door knocking. We've knocked on 14,000 doors. Many of the doors we would go up to, large 3 to 4 bedroom houses, have one person living in them. Often an elderly woman struggling to maintain taking care of a large house. Her children have moved away, a spouse is no longer with her, and there she is struggling with not just upkeep, but taxes. I've spoken to a number of the community developers and staff people in City of Courtenay and in Comox. The idea of a matchmaking service that brings people who have space in their houses, vets people who are looking for space, students, I think, are probably one of the low barriers. Putting students and seniors together, allowing, the students to support the senior by mowing the lawn, maybe having a reduction in their rent because of this caretaking. That's one way of increasing the amount of available space supported by either local government or a nonprofit to do the vetting and to check in, because seniors are vulnerable people and we have to make sure that people don't take advantage of them. So that is something that has to be constantly looked over. I am one to try and see where is it that we can create some space and not have to always constantly build. So we know that that's one, seniors and young people. When I lived in Richmond, I worked with a nonprofit group called the Turning Point Society. It worked with men who were in recovery, and Turning Point purchased houses and turned them into recovery homes. So they used already existing stock and then allowed, 5, 6 people. There was always a 24/7 live-in caretaker, but then it housed 5 or 6 of these men while they were going through their treatment. Again, these houses were in residential neighborhoods. And yes, people freaked out when they heard about it until they found out, actually,
You have 1 minute.
it's the house down the street, and they are the best neighbors. They were mowing everybody's lawn, taking care, they were volunteering in the community. It's not something to be scared of, it's actually something to be embraced. The reintegration of people who are in addiction into community, so that A, community also benefits from their volunteering, and B, we get to move people off of the streets using housing stock we already have.
In Finland and other places in Europe, they have this opposite approach to what we have. Is they enshrine it into their human rights. That is their human right to have shelter.
Housing,
So they have
yeah.
a homeless person, they take that homeless person, and they put them in a shelter, no charge, and they ultimately end up with an 80% success rate.
Yeah.
That they end up after rehabilitation, which falls.
Yeah.
They become taxpayers to
Yeah.
support the system that they're using.
So one thing I didn't get a chance to talk about is the tiny home village model. So it's very similar to what you're talking about. Housing first, right? Yeah.
So that was our sixth question of the forum. So I'm just going to wait for people to wrap it up as best we can, because we're moving on. So this is the moment in the forum where we get the candidates to actually change seats. So we're asking for people that are sort of in the electoral
At the different levels of government. So Bob and I know each other from being on council together. I was a local Area B director on the CVRD. Bob was chair. I was vice chair for a year. Similarly, I have very good relationships with Nicole, with Vicky, with most of the other council members. It is, for me, it's not intimidating to go to council, but I know for many it can be. So it means sitting side by side with people, helping them when they need to make the presentation. But honestly, it should not be in my words. It needs to be in the words that are from the people who are being impacted. Because when Julia told her stories of tripping and falling and then not being able to get back up again because of her disability, that's what makes the difference. That's when people understand the impact of a strip of paint on a step. If I had said that story, it would not have had the same type of impact. So I think that model of working in community with the people who need and who can identify what changes need to be done, I can't see any other way of doing this. I don't think this requires people coming from outside of the community, consultants with their big dollars. We know what needs to be done in this community. We know that when the regional district building was built, it was built to the building code, which is meant to accommodate people with disability. But more and more we're seeing that the building code is not keeping up with current issues. Many people are in motorized scooters now. And most bathrooms do not have enough space for a motorized scooter to turn around in. We said that to the regional district before the building was even, fully completed. And they, at the time, said, no, we're building it to code. This is the way we've done it. Finally, I think now, 2 of the bathrooms were combined so that a motorized scooter could fit into the building. It requires, the board to agree that this is something that's important, that we need to put funds towards, but it also requires community to identify that this was an issue. Again, unfortunately, the building code needs to be updated to keep up with what modern people need for their daily accessibility. So I think did that answer the question? Did I miss anything for people in the audience? No. It's really working with community, and I know that the issues of youth are different from the issues of older people. So making sure that all of the voices are heard. That's it. Ooh, that was fast.
Candidates, you have 1 minute. 1 minute.
While we're here, any questions that anybody wants to slip in while we're waiting? Yeah. Sure. So the question is, how would people with disabilities even get to me? Well, number one, first and foremost, I will answer questions. I will answer phones. I will answer emails. The other way, so being personally accessible, I think is incredibly important, and it's something we've been missing for the last 6 years. On top of that, we have a number of accessibility committees that are already formed with the City of Courtenay, with the Regional District. Social Planning Society has an accessible committee. So making sure that we're always in contact with those organizations. But honestly, people like Julia and others have kind of come to me from outside. They're not part of any organization. It's just, it's being accessible.
Wrap up your answer, please, and we'll move on to the next question. The next question comes to us from the Comox Valley Substance Use Strategy, which is operated by the Indigenous Food Sharing Society. And the question is, there has been a lot of conversation in the media about the recent announcement of plans to increase involuntary treatment for those with acute mental health and substance use issues, which many experts do not support, as the evidence shows Further, there are often harms from human rights violations to higher risk of death from the unregulated drug supply after release. Do you support involuntary treatment? And if so, how will you ensure it is to be effective, evidence-based, will minimize harm, and provide long-term success for patients?
Big question. So, in general, I do not support involuntary care, with the one exception, and this is something that I was listening to on CBC radio. Did anybody catch Cross Country Checkup on the weekend? So the only time that it has been seen to have evidence of being beneficial is with young people who don't still have the ingrained habits formed and can potentially would react to adults intervening in a more positive way. Apart from that, as Chris mentioned, there is absolutely no evidence to show that involuntary care will even work. Putting people in a building, whatever it is, if it's a prison, this is one of the most expensive ways of treating people. And it's the most traumatic way of dealing with people. Why would we want to re-traumatize people? We know most of the people who are on the streets of Courtenay and any community have their own childhood traumas that have happened to them along their lifetimes. And here we are, and not we, sorry, the BC Greens do not support involuntary care at all. But even the suggestion of putting people by force into treatment is re-traumatizing them. So it's not something that we support. What we do support, we're here, we have a lot of unhoused people with addictions that are not under control. And right now, certain parties want us to go there, involuntary care. How about some voluntary care, which we don't actually have access to in the Valley? We have, if anybody here knows anyone who's struggling with addiction, and if today they picked up the phone and said, I want to go into treatment, it is a 3 to 6 month wait list. Right? You probably know more, right? I just heard the wait list for Amethyst House, which is one of our treatment facilities, 300 people long. So in the last 6 years, we have had zero increase in capacity of treatment in our community. And that absolutely needs to be addressed. We need more places for people to go and voluntarily go into treatment. The other thing we need is aftercare. Someone can go into treatment to detox and then treatment, but then what? They're left to their own devices as soon as they get back into community, and they are at more risk of overdosing than ever before. We need the aftercare to help monitor them and make sure that they can integrate back into community in a safe way. It's not happening right now. It would not cost the world the way that putting people in prisons and even building facilities to involuntarily care for them. There is so much more that we could be doing in community, and we're not. Let's not go to the extremes. We know there are other ways that we can work that actually benefit this community. We need housing for everybody who is currently on the streets. The trauma of living unhoused cannot be spoken about. Housing first, getting people in humane and dignified housing is another platform that I have been pushing for specifically for our community. Now, what I've been asking for is tiny home villages. It is a model that has worked incredibly well in Duncan. You know, these houses, they're tiny homes. There's space for a bed, a closet, space for some things. You can lock yourself in at night, feel safe. No one's kicking you out. And then when you finally have settled, the possibility of then going for treatment, going for detox, going for job training, or being placed in more permanent housing. This is the stepping stone that we are missing in the community. Every other community around us has this. I don't know if everybody knows. It was started in Duncan. Nanaimo has this. Port Alberni has this, and Campbell River is building theirs now. How did we get missed in terms of a community with such a large, we have almost 300 people who are unhoused in our community. How did we get missed in this model? We need a stronger advocate who are taking ideas from communities where we've seen that it works and advocating for it for us. And that's what I can do as a Green Party member, because I'm not tied to what my party is saying. If this community says, no, we need this instead, this is what I advocate for. So this idea of tiny homes came from the Coalition to End Homelessness, came from those who are actually experiencing being unhoused. And so this is what I'm putting forward, because they're not asking for giant shelters. They're asking for more humane, dignified living.
From the Comox Valley Food Policy Council. So in budget 2023, the province of BC invested $214 million over 3 years towards school food programs. If elected, how would you support school food programs for students across the province? And how would you ensure that both legislative policy as well as funding is supported?
So this is one of my favorite topics, because being a farmer and food and youth and feeding people. So $214 million sounds like an incredible lot of money, right? When you boil it down, each school district in BC is currently getting about $1 million of funding to feed children. It is only feeding 20% of our children right now. So we know 80% are not getting food. And those 20% are the special kids, right? This food is for that group. It can be very stigmatizing to have a program like that. What we need, and what the Green Party, what I've been able to advocate to the Green Party to have as part of their platform, is a universal school food program, so that 5 days a week, every child, K to 12, is fed a lunch in school. If anyone grew up outside of Canada, this is a norm in most other countries. It is only Canada, the last of the G7 countries, that does not have a school food program. So the province of BC has slightly committed. The federal government is also putting some money towards it. What the Greens are asking for is a robust system where every child is fed. On top of that, I will be advocating for 30% of that food to be sourced locally. The reason for that is, A, it's fresher. B, it connects our young people to where their food is actually coming from. The relationships that for many young people are lost if they've only ever seen food come out of a supermarket. Thirdly, a fully funded universal school food program, if we just put 30% of that funding into local farms, that is $900,000 going into the local farm community every year. It is revolutionary. This could mean the huge difference from people who are currently just farming a quarter acre or a half acre to really investing in producing in quantity. Because we know right now, and I'm a small farmer, I'm fully aware, when you are farming in small scale, labor, and you're relying on labor to do most of your work, that is the most expensive part of your production, the cost of labor. When you are now asking farmers to produce 200 bunches of carrots a day, that is suddenly at a different level. You are now going to be investing in mechanization, and that will actually bring the cost of food down, if it makes sense, right? The more quantity we produce. So I'm seeing the Universal School Food Program as a way of actually helping us increase the amount of food that's grown in the valley, but also drop the price, because we can all start growing in bulk. Sieverts does a fantastic job of this, right? Their produce is very well priced. I wish it was organic, but it's still local. We need 10 Sieverts in the valley in order to just supply the school food system. Isn't that amazing? And once we get school food, then we're going to move to hospital food, right? Because we all know how disgusting that is right now. And then on from that. Using the government's ability to procure and procuring what we actually want to see in our communities is something that does not require, multiple policies. It just should be done. We should try to circulate as much of our dollars here in community. So I know Denmark has now moved that up to something like 70 or 80%. When I say 30% to the local farming community, they're like, ooh. So let's start baby steps, and then we can start moving 40%, 50%, and then the sky's the limit. So fast and easy answer, because I knew that one really well. Yeah. But you know what? Before we can do that, we have to solve the water issue. I hope when you had the discussion about water, it is right now the stranglehold on farming. I know 2 young farmers, new farmers, who were not giving water rights to their farms. They're literally farming a half acre, a quarter acre, and the province said, no, you can't have water out of the aquifer. How do you farm without water?
1 minute, candidates, 1 minute.
And yet, Mr. What's-his-name got his water bottling license up in Merville. We're okay if it's for industrial use, but for whatever reason, when it's a farmer, we can't quite find the water for them. Yeah. For that, so we have a ministry called Water, Lands, and Resource Sustainability, who on the one hand, when they gave the license to the water bottler, said, Aquifer 408, huge, it's immense. He's only getting 10,000 liters a day. It's okay. We have a lot. And then not even 4 years later, after the drought, suddenly realizing, actually, water isn't everywhere. It's not. So we have a ministry who's not well funded.
Candidates, we're going to wrap up and move on to the next question.
Yeah, we just don't have a lot of funding for that.
And the next question comes to us from the Comox Valley Social Planning Society. The 2003 living wage in the Comox Valley is $22.02 an hour, and we have seen significant increases in the living wage over the past 2 years. This burden falls solely on small business owners right now. However, having a decent standard of living is impacted by good public policy such as government income supports, labor market reforms, including increased availability and unionization, and accessible and equitable public infrastructure and services that reduce the cost of living and improve affordability. Please give a specific example of a public policy you will introduce or support to reduce the cost of living and improve affordability.
Right. I think the biggest thing that will impact affordability in the Comox Valley is housing. So I'm going to go on. It's housing. It's affordable housing. That in itself will create so much support for people who are struggling right now. So I'm just going to say it on and on. Just know, housing, housing, housing. I will be pushing for government investment in housing so that rent can be tied to income. Now, on top of that, what are the other policies? The BC Greens have put forward an incredibly robust and very forward-thinking policy around free transit for all. So that means, not having to, and the transit needs to be not just free, it needs to be frequent, and it needs to be fast. Like that requires a very big overhaul of the transit system in the Comox Valley. Does anyone ride a bus in the valley? Yeah. It is very difficult to get from A to B in the valley, and we need more buses, we need more bus routes, and that will require provincial investment in our system. But a policy like that would be an incredible bonus for anybody who depends on busing. Whether you're a student going to the college, student going to high school, or even just people trying to get to work through the bus system, having it be free is literally money in your pocket. The previous policy that I talked about, the Universal School Food Program, for parents who have children who no longer have to buy the groceries for lunch 5 days a week, I think that would be a very big support for them, for who are struggling, because we know especially fruits and vegetables are incredibly expensive through the winter months especially, and government can buy that produce, in quantity at a rate that is often much less than what individuals can pay for that. So transit, housing, food, what else can we do? I'm maybe going to put this out to you because these are some of the platforms we've already been pushing for in terms of poverty alleviation. Obviously, the very first question was around disability benefits and not clawing them back. Yeah. Yes. So such a good question. Right now, our budget in British Columbia, the question was, how are we going to pay for all of this, right? Of course. Our budget right now is $89 billion in the province of BC. That is the same budget for the country of Denmark. So Denmark's smaller, I get it, but the population, and between that and BC, and think of all of the amazing things that Denmark has. Not only do they have free education up into the university level, they have benefits that we can't even start to imagine. Now, $89 billion, what are we spending that on right now? $1.3 billion of your taxes go to subsidize oil and gas right now. Does that sector seem like it's a needy sector to you? I mean, any oil executive you've met lately that's on welfare? No. And yet we treat the polluting industries as if they are welfare recipients, requiring our subsidization, when in fact they are the ones that are polluting our societies, that are causing climate change to happen. We need to move that $1.3 billion away from that subsidy and into a universal school food program. That would pay for it. That program alone. What else is happening? Okay, we have in BC 7 health authorities. Why do we need 7 health authorities? Across 7 health authorities, we have 70 vice presidents, all who are being paid 6-figure salaries. Okay, can we maybe find some, efficiencies? Our healthcare system is incredibly top-heavy. We need to move the wages from the top, get rid of those levels, and bring them to the bottom. We desperately need more nurses, more healthcare workers, personal care workers. The money for that, I think, can be redistributed. So the BC Greens are not asking for any kind of tax cuts at the moment. We need to see exactly where our money is being spent. And carbon tax, I should say, brings $3.5 billion into our economy. Anyone who's wanting to cut that right now, please tell me what are you going to cut that's worth $3.5 billion, because it's a huge influx into our system. We do need to see that tax specifically supporting low-income families, and so the BC Greens have said, when we get into power, not only will we increase the carbon tax on polluters, that money will go directly to families, low-income families, as a rebate. So right now, low-income families are getting $500 per person, $1,000 per family. That needs to be increased. So, yeah. The Trans-American Pipeline, or the TMX, yeah, should never have been purchased by government. It's a polluting industry. They should have done it on their own. And if the First Nations said no, that should have been a no hard stop.
So the next question, we're going to move on to the next question now. This next question is from the Comox Valley Early Years Collaborative. And here's the question. Research indicates that children in their early years could benefit from support, especially regarding their social and emotional wellness. What would you do to further ensure that the mental and social well-being of children and families is being supported in ways that have previously been lacking?
I'm just going to say no more subsidies to TMX, and then let's see how they survive. Yeah, the infrastructure is still already there, but let's see what happens. So coming back to this issue around children, mental health, and supports. I spoke to a teacher at Lake Trail. She's currently has, a class of 25, I believe. One student who has cerebral palsy, who needs support to go to the bathroom. The poor child needed to go to the toilet. She was on her own in that class. She had to make the choice. Do I take this child to the bathroom and my entire class go crazy while I'm gone supporting this child? Or do I ignore this and stay? These are the decisions, unfortunately, our teachers are making every day. Why do we not have another EC or another EA, an education assistant, in every single classroom? Our children and our schools are not the same as they were when I grew up. I wish we had had extra EAs. I remember children, it's not that youth these days are more prone to having, behavioral issues. We had behavioral issues back in the 70s and 80s. They just got unaddressed. Kids got kicked out, sent to the principal all the time. Right now, we're trying to tackle those issues in class, and teachers are not supported to do that. So we need, again, more EAs in classrooms. Does everyone know what an EA is, an education assistant? So not only do we need more, right now, most of them are being paid part-time hours because our school district does not want to pay them benefits. So we're going to be increasing the budgets specifically for EAs, increasing their hours so that they can support teachers to do the work that needs to be done in class. How do we attract more people to be EAs? Again, it does require education. It does require going to school. So providing bursaries and supports for anybody who is going through that in schools to incentivize more people to get those credentials. And then having the budgets for them to be in classes. That universal school food program needs to be run by an EA, I must say. It's not going to be relying on parent volunteers, right? It needs to be funded and embedded into school systems. So yes, again, there will be more funding required. Education has been ignored for the last few years. I am seeing way more money is going to healthcare, I know, but here's where we do the prevention for the young people who end up on our streets. It was very heartbreaking. That same teacher from Lake Trail was saying, when kids come in kindergarten, we see the kids who do not have the proper emotional and social supports, and we guess which ones will be ending up on the streets. It's such a sad, situation right now. We could intervene, and that schools is where we could do the intervention so they don't end up costing us down the road, right? Here is our prevention. So, and I'll get to you. We, the Greens, have proposed that every school also have a full-time psychologist on staff that can support students that are having their mental health issues and can provide plans for them, work with families to ensure that students are being supported in the ways that they need to. No, sorry.
So approximately how much will your plan cost?
Yeah.
Like higher salaries,
Yes.
bursaries, and now a psychologist for every student.
Yeah. So again, Ministry of Education is another ministry that has a lot of bureaucracy in it. Anybody work in that ministry or know a little bit about that? What the Greens are looking for is to create those efficiencies, remove bureaucracy, hire more teachers. It is actually way more cost effective to hire EAs than it is to even have teachers. So this is where right now our emphasis we're seeing, we need more bodies, more adults in classrooms. To be an EA does not require the 4-year degree that most teachers require. So this is a more cost-effective way of supporting students. and then moving forward. So I just printed off the green platform that was revealed today, so I don't have the costing for you, but I will look it up to see what the greens are looking at. Oh, yes. Yes. I mean, I know of a lot of wastage in agriculture because I've worked in that industry. I worked in the funding side. I know where
Candidates, we're going to get you to wrap it up. It is actually time
there's
to move
slush
tables
funds,
now,
right?
So we're going to get John Etiquette to move over to table 2. We've got 6 more to go.
Come on in. Come on in.
This question comes to us from the Immigrant Welcome Society Center. The Immigrant Welcome Center's 2003 needs assessment research shows that many immigrants who live here are employed below the level of their skills and expertise. How would your party reduce barriers to employment so that newcomers are not employed?
Okay. So this is a little bit complicated because I used to work as a professional agrologist, and that requires a degree in agriculture and then being an articling agrologist. We have a institute that oversees our qualifications and checks that everybody has the things that they need to call themselves an agrologist. What I have seen in the past is that institute will often act as a gatekeeper, preventing new immigrants from coming in and working in the profession. Often they'll use like antiquated ideas of what international universities, the level of education they provide. So I know the government has done a very big overhaul on public institutions that oversee professional designations. So we need to ensure that new immigrants have those connections and that they are streamlined into working. I mean, I've worked with people who did their degrees in Somalia, in Kenya, were professors in universities, and they come to BC and they end up being the tech person, like the lowest of the low in the agricultural projects, when they have got decades and decades of experience. So highlighting two institutes that provide those professional designations, streamlining the process of new immigrants getting their professional designations. It's also, so it's not just agriculture. I mean, we see this with doctors. You've heard that whole expression that, most of the taxi drivers in the big cities are usually doctors. Again, that process is being monitored, and I would probably say prevented from being streamlined by the doctors themselves. Not wanting the competition or not wanting to even admit that other countries have certain levels of expertise and that there is good education outside of North American approved systems. We desperately need doctors, right? I was part of a group that helped to sponsor a Syrian family to come to Canada. Husband was a doctor with the UN, wife was a doctor, and sister was a lawyer. So husband got a job as a pharmacy technician, which is fantastic. Still below his level of expertise, but we're hoping to sort of move him in that direction. I forget what the Doctors Association's called. They're a tough nut to crack, so it may take a while. Will probably require a little bit of retraining. Unfortunately, both the wife and the sister are working as ECE, like in daycare. Is this ego-based problems? I think it's liability. Like, we're such a liability adverse, right? Like, oh my gosh, what would happen if we allowed this guy in and then he does a mistake? Well, we're all human, but so that's my biggest guess is this is what's preventing people from being streamlined and onboarded is legal. The insurance and the liability. Sorry, you had a question?
I'm just wondering, there are the associations, you mentioned the doctors.
Yeah.
Some are hesitant to expand the field, and I can understand that. But for accreditation,
Yes.
do you see a role of provinces, universities to
Candidates have 1 minute.
have numbers of, let's
Yeah.
You know, are there enough pharmacists coming to BC
Right.
to have university develop a course
Course. Yeah.
that would get them the
Yeah.
accreditation, bring them up
Right.
so they understand the pay?
Yeah, yeah. So I pharmacists specifically, I don't know. What I do know, what I do know is it's the medical fields that the province is putting all their attention on because we're so desperately in need of doctors and nurses and healthcare workers. From my understanding, there is an understanding or an agreement with. Some of this is federally regulated, right? It's like immigrants come in at the federal level, but there is interaction between province and federal to say how many people we need. So I think the numbers are there. How much that actually affects who is let in, I am not sure, because there's just been some funny business that's happened at the federal level. Our relationship with India is not strong anymore because of intergovernment problems. So and Modi, and yes, so I don't know if there's always a role for province, but the information's there. Yeah.
Society. So it's asking candidates, please note 4 specific actions that you will take to support and foster the growth and safety of the trans community in the Comox Valley.
Yeah, okay. So, I mentioned this at the previous table. We are living in a time when we are in such desperate need of people's full creativity and ideas and problem solving. I mean, we've got multiple crises happening with climate, with the opioid crisis, with mental health. We need everybody at the table, and we need their full selves to be at the table with us. And whatever we can do to make people feel comfortable and included and welcomed as their full self needs to be supported. So whether that is standing beside trans people at Pride or wherever they need me to be beside them, whether it is, and I've said it already, I support SOGI 123. I want to reduce bullying in schools. We need more education on how we accept people in our community. I am there. It's not a popular stance to take with some people, but we just have to be unequivocal about this. Like, there are too many youth suicides that are happening within this community for us to say that there is any other option than support and love and inclusion. So I don't know if that was 4, but standing beside people, welcoming them, letting them know that we need them, that they need to be here. I mentioned at the other table, I just recently watched a really wonderful documentary on Netflix called Will and Harper. If any of you have seen it, or if you haven't seen it, you've got Netflix. It follows Will Ferrell, the comedian, on a cross-country U.S. road trip with one of his best friends, longest friends, who recently transitioned to a woman. And just how he'd never spent time with this person as a female. Would their friendship still be the same? They asked all the awkward questions. I think it's incredibly heartwarming and really, I mean, for me, anybody who's uncomfortable with the subject, I think it's a really nice way of answering those more uncomfortable questions. They stop in Texas, so I'm not going to give it away, but you can imagine some of the things that happen. And it also shows some very specific ways of how you be an ally, and sometimes in your eagerness to support your friends, how you stumble and you stop being an ally. So we're not going to, this is very new to our community, the inclusion of trans people. We're not going to get everything right. I think we need to be compassionate with ourselves, but show that we are really trying and that, we need everybody here. Yeah. Yeah.
There is some barriers in the Ministry of Health or the Medical Association for services, either drugs or surgeries at this point.
There probably are. I hadn't heard about barriers, like specifically in the medical system, but I know, I'm just hearing there was There was recently a bill that was passed. Do you remember the name Schoenborn? He murdered his children and then changed his name so that nobody would know where he was. So the province passed a bill, anybody with a conviction, you can't change your name. Well, I mean, it's not just murderers that this happens to. If you are trans and you want to now transition, you've got an old name and you want to formalize a new name, you can't anymore because of this. If you've had any kind of interaction with the law before, so for trans people, for people who are Indigenous and want to adopt their Indigenous name with the new spelling, that's also off the table now. So sometimes, we just unwittingly do these kinds of things and don't realize the impacts it can have, especially on the trans community. But I will look up and see if there are medical issues. Yeah.
Do you support schools not having to or having to inform parents of a child under 16 who is experimenting with
Yeah. Okay, so I'm saying this as a parent of two girls, right? Knowing my two kids and what it was like to be a parent. I always hoped that we had an open line of communication, right? And that they could come to me with anything. Often they came to me years after anything happened, but okay, I heard about it after. If my children were not comfortable with me knowing that they were changing their pronouns, changing their names, I would hope
Time is up on that question. Please finish up your sentence.
I would hope they would feel safe at school to do so. And if they've asked that, I don't know. Obviously there is an issue between my relationship with them. Yeah.
Question now. This comes to us from
If not, it would be mine. Yeah.
And the question is, many policies aimed at addressing homelessness are not meeting the needs of those most impacted by the housing crisis. How do you plan to meaningfully involve people experiencing homelessness in shaping policies, programs, and priorities that directly affect them? What strategies will you use to ensure their voices are central in developing situations?
Yeah. So this question really, I think, reveals the way that I prefer to work in community, and that is to work with those who are directly being impacted by policy. So if we're talking about policy for homeless community, I don't think it's one that I can do with people in this room necessarily. It needs to be with those who are experiencing that issue themselves. Having connections with the homeless community, having connections with the service providers who are working with the homeless community is the very first step. Okay? It's no decision about us without us is what I've heard from that community, and I try and keep that in as part of my ethos. So I have already met with members of the Coalition to End Homelessness. I've been at the Friday noon hour meetings with people who are currently unhoused. They have told me what they need is tiny home houses. They are not asking for a giant shelter. They specifically asked for tiny home villages. Places no more than 30 to 35, so you can create a community, live in, caretaker 24/7. The model is already working incredibly well in Duncan, where it started 5 years ago. So we're not recreating the wheel. In Duncan, yeah. And the cost at the time was only $350,000 for 35 units. Very cost effective because they have a bed, a closet, some space for your things. There's no plumbing in them. And that's on purpose. I know it sounds really cruel, but what it means is that people have to leave their units to go use the central bathroom and shower and kitchen, and people can check in on them and see what's going on. And then the mental health care worker or the addictions worker who's on site gets to see them, and they then create these relationships of trust. And once that trust is built, it's so much easier for people to access the services if they are available. Hopefully, Greens will be advocating for more treatment in the Comox Valley. But that model is something that the community themselves are asking for. They're actually asking for 2 villages. One for people who are in recovery or who don't have an addiction, and for a separate one for people who are actively using, because the 2 don't want to necessarily be around each other, right? It impacts their sobriety, their addiction, their recovery, and you need different supports for different. I was door knocking around Braidwood, right, the other day, and every house, every apartment that I knocked on, I asked them, what do you think about this idea of having like a 35 unit tiny home village? We could even make it the sober one, the one, where people on recovery. Would you oppose that on that site that BC Housing has just bought? And nobody said no. They all said this is the better choice for us. This is something that our community could support. There would be no pushback from the community, because people can see that this is a good solution, that it's a stepping stone from the street to now having a safe place to stay where you can lock yourself in at night, no one's kicking you out, and then when you're settled you can move into detox, treatment, job training, permanent housing. It's the missing piece right now. Yeah. Yes, it would. Although what Duncan has done is they've cycled people through. So the first 35 are not the same 35 that are there now. Like, it's not meant to be a permanent situation. It's to get yourself out of fight and flight, being on the streets, get yourself settled, and then when you're feeling safe, to be able to move on to another site. Yeah. Yes.
Program on Sundays for anyone
Yes.
for a meal. And one of the things that is the common thread is the sense of community
Yes.
that happens
Yeah.
on that Sunday. There's zero judgment. It's a service. They get food, they get a meal, they get placed.
And do you get any weird behaviors, or not weird? Yes, but
While we've had, I think, 2 incidents in
Yeah.
the last 4 years since we've been going.
That's-
And the thing is, what happens is the other people, yes, they
Come in.
make it happen. They disappear.
Yeah.
Like, if you
shut it down, right?
don't
Yeah.
Candidates,
Yeah.
wrap up.
I love that. Thank you for Sunday Station. You are one of the reasons why I'm giving these types of solutions, because I see people in this community care. They don't want to be sweeping people.
Comox Valley
Yeah.
Senior Support Society.
Yeah. Yeah.
Affordable, accessible, and interconnected public transit can address many social issues, including equity and inclusion, climate change, and quality of life. How do you perceive the role and future of public transit? What changes, if any, would you work towards and advocate for in public transit improvements in the Comox Valley, Vancouver Island, and beyond?
Where do I start with that question? Okay, so as someone who lives in the rural areas, a bus goes by my place. It's about a 500-meter walk to the bus stop. Like, you flag it down, but the bus only goes by 5 days a week, five times a day. So if I want to go into Courtenay, I need to get out of Courtenay by 4 p.m. or I am stuck. And then it's a cab ride home, which is incredibly expensive. We do not have a properly functioning transit system that is working for most people. Maybe I think it's working for some of the college students who are able to, but not, okay, no. Yeah. No. Yeah. Yeah, we have no transit to Tin Town, which is one of our busiest industrial areas, right? Where we have a lot of work. Has anyone tried to drive in Tin Town on a weekday? Like, there's cars everywhere, and there's very little parking left because staff are taking up all of the street space. So we know we need investment. The Greens have a very ambitious program of free transit. Yes. And oh my God, the cost. Okay, so obviously phased in. We currently give free transit to every child who is in elementary school. How about we now move that to high school next year, and then after that to college, and maybe at the same time give all seniors free transit? I think that grouping alone, not only would it revolutionize how many people use transit, but it would take so many cars off of the road, parents driving around. It will require a lot of investment. I'm not going to underestimate how much the cost is going to be, but I just saw the estimate from the Ministry of Transport. In order to maintain our roads for just regular traffic, it's about $900 per person that we all pay as part of our taxes to the Ministry of Transport. The cost, if it's a transit primary route, is something like $270 a person. The cost savings just on wear and tear of our roads could be a huge cost savings to cities and to the ministry. So we know there can be savings in other places if we move in this direction. And then yes, accessibility, having free transit, again, a pocketbook affordability issue with people who are struggling right now. If they're dependent on buses, this would be an incredible, bonus for not having to pay for transit, out of their pocketbook. So we need to incentivize more people to use transit. Only 3% of the population of the Comox Valley uses transit right now. Right. One person. Smaller. Yeah. Yes. I love it. Yeah. Yeah, I think we have way more creative solutions. You're right. We don't need the giant buses except during rush hour in the mornings when, I've seen very full buses go to the college. So there are certain routes, but as you mentioned, there are most times the smaller buses would be so much better. Yes.
What we were going to comment, because since we moved here 4 years ago, we're shocked by the empty bus driving by always. And I'm just curious, who actually determines the routes and the size?
Yeah. It's actually regional district. So it is a local government level. So obviously, regional district pays for 50%, and then BC Transit pays for 50%. So it's half and half.
Based on user fees.
Yes. And then, but it is the regional district that sets the routes and the frequency of those routes. So it requires a little bit. Yeah. Yes. BC Transit purchases the buses, and then, interestingly, our drivers are contracted by a U.S.-based company. Did everybody know that? Yes. Do you remember the strike that happened at Christmas time? Yeah, TW Transport is, where is it based out of? It's not Philadelphia. It's one of those. It was very odd. Yeah. So there is actually a private company that has the contract for Comox Valley and Campbell River. They're unionized, yes, but their union, their employer is a private company. Same with our school buses, is also a U.S.-based company, but that's an aside. So, yeah, electric, yeah, yeah. Electric transit buses are almost here. Yeah.
Substance use strategy run by the Indigenous Women Sharing Society. People who use substances and Indigenous people report to us regularly that they are experiencing systemic racism and poor quality of health care. What will you do to ensure healthcare workers and law enforcement workers are provided with significant anti-racism training and monitoring to create culturally safe spaces and address systemic racism and discriminatory practices? What
was that? Oh, yeah, I wish. Okay. this issue has been an issue for years and years, if not, well, I mean, as everyone saw yesterday on National Day of Truth and Reconciliation, we have some embedded systemic racism in our communities, in our healthcare system, and in our police system. So let's not look away or pretend that that isn't there. It's embedded. I've met a lot of nurses, a lot of retired nurses, who very much reflect what we've just heard in the question. When they see Indigenous people come to the hospital, they're often saying that they are asking for drugs, they're not really in pain, that this is not, an issue. Yeah. How do you force empathy? I'm not sure if that is a possibility, but I think we can embed training programs that are really, really effective. Yeah. Yeah. How do you? Yeah. 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 Sure. So some of the experiential training that I've been through, I've done the blanket exercise and the village with Kathy Camilleri. I think that needs to be mandatory before any student graduates from the nursing program or from doctors, right? Get them while they don't have their opinions set, right? Get them while they're young. How do you work with some of the embedded issues? I think that may require a stick approach, unfortunately, because it's very difficult to change embedded, ingrained attitudes without some kind of penalty. Yeah, unfortunately, right? Does anyone have examples of better ideas? I mean, I'm here thinking about this. Obviously, I would never put forward a policy without asking, nurses themselves and doctors themselves, what are you seeing working? What are you hearing is the issue? Has anyone ever done the walk with me with the art gallery? Okay, if they put it on again, and I think they are, it's an audio experience where stories of people who are homeless, who are suffering from homelessness, you do a set walk around downtown and over the bridge, and I clearly remember one of the stories being of someone who went to the hospital and how they were treated. And, as you're walking, you're imagining yourself be that person. There has to be like that empathy, that empathizing with people and hearing their story and just being horrified and then wanting things to change. Yeah, it's a tough one. Like I said, how do you enforce empathy? Yeah. Yeah. Thank you. Yeah. Yeah. Yes. Right. Right. So you've seen it. Okay. Thank you. Feels safe enough. Yeah. Yeah. Yeah.
Candidates have 1 minute.
Wow. I mean, do we need cameras in hospitals now? Yeah. Yeah. Especially where people are very vulnerable. Yeah. 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 Well, let's come up with the local solutions, right? That's what I'm all about. Yeah. Totally. Yeah. 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 Right. Right. Yeah. Yeah.
Okay, candidates, wrap that up.
Yeah.
We've made
Don't.
it to
Thank you.
last
Thank
question.
you.
We're now going to the very
Yeah.
last question. You've almost made it, folks. You're doing great if you're still here. This last question is from the Comox Valley Food Policy Council. The Comox Valley agricultural community is facing several challenges, including high land prices, increased cost of getting inputs to the island, and climate change. How would you support farmers and the local food system?
Perfect question. Okay, and I can make it really fast because I know what we need to. Well, I've spoken to enough farmers with the Mid-Island Farmers Institute, with the Comox Valley Farmers Institute, who've told me this is what we need to do. So we on Vancouver Island do pay way higher for our input costs. My own organic fertilizer comes from the Fraser Valley, and there's an extra $400 shipping fee to get it here. We don't have enough local product. So for in the short term, we need BC Ferries to provide agricultural inputs. And I don't know if you know, a lot of our meat producers often send their animals off island to be processed and then shipped back. We have one last commercial turkey producer who's here in the Comox Valley. His ferry and trucking cost alone is $10,000. And that is passed on to then the price of the food, right? So in the short term, BC Ferries used to have a specific agricultural rate to enable farmers to move their product easily back and forth. So reinstate that. In the medium term then, we need to increase the capacity for processing, and this is abattoirs. So any meat eaters, this is what we need. We need more on Vancouver Island so farmers aren't sending their animals off island to be processed. So that used to be the way. And then in the 1990s, it was then the Liberal government decided to clamp down on meat regulations, and many farmers who were processing on farm or in small scale abattoirs lost the ability to process. We are now slowly making our way back from that, and it needs to happen in a hurry because the island, I think everybody knows, we only produce 4% of what we eat here. 96% of our food is coming on a ferry from off island. Yeah.
What would you think of relieving farmers of the carbon tax and creating an exemption?
Yeah, so the only farmers that I know that pay carbon tax here on Vancouver Island are those who use propane, natural gas, for heating. So some of the greenhouse producers and anyone who's got a heated barn. There are not many, actually. So, yeah. Right, yes. Right. So on the fertilizer side, though, we really need to encourage farmers to reduce the amount of nitrogen, synthetic nitrogen fertilizer they're putting on their land. It is an incredible greenhouse gas emitter. There is a lot of overuse of nitrogen right now. Now, mind you, costs have gone up quite incredibly. So a lot of farms are actually going back to using manure. As an organic farmer, I have to get, because we've only ever used manure, animal-based products. But for some farms, this is a brand new thing of trying out what manure is, like composted manure is, and how it reacts, because it obviously reacts very differently on the land. But we do need to reduce. So keeping the carbon tax on those polluting inputs needs to stay, in my opinion. Otherwise, you do not incentivize the change in the behavior. Yeah, we need more animal production on the island, I should also say. We need more manure. So does everyone understand the tie between animal production and organic vegetables or organic anything? We lose animal production, there is no more organic anything left. Yeah, sorry.
So if we tax the inputs here,
yeah.
we just import from other places, which aren't as
Yeah, I think the solution, yeah.
using fuel to ship it.
Yeah. I think the solution is to relocalize. Does everyone know we've got 100,000 acres of agricultural land in the Comox Valley? We are only actively farming, like producing food directly on 30,000 of it. There is a lot of unused land here. So, yes. Yeah. Yeah, absolutely. Group? Yeah. I love it. I think that was actually when the ALC, when the Agricultural Land Commission was first formed, the ALC actually owned land and it leased land to farmers. So that is absolutely one direction we need to use, because in certain areas, that is the only new purchaser of farmland is going to be government. Who else? I can't afford farmland anymore. Yeah. Yeah. Young Agrarians is also doing the matchmaking. So it's a group called the Young Agrarians. Yeah.
Long haul for you, I'm sure. And thank you for being here for the
Yeah.
second half as well. Thank you to the electors who have hung in. We know the acoustics aren't that great in here, and we made an executive decision up here that next year we will figure that issue out so that we have better sound. We just need to come up with it. We did a money before.
Yeah. Well, they were way smaller last year, so I think they were not.
For a few
Yeah.
people